Hey guys, I'm Dr. Chaz Vitito, the dentist here at the local dentist in Bellingham, Washington. And if you have chosen to become a patient with us and trust us with your care, then you probably received some information about this. I just want to explain a little bit more about how we talk about the 5 ways that your oral health affects your overall health. The first one, probably the most obvious, is tooth decay, right? People know that having cavities can spread, it can turn into other problems, and you need to get it taken care of, right? Whether it's getting a filling or a crown or some sort of restoration to restore tooth structure that's been lost. But tooth decay has been shown to obviously lead to a higher level of bacteria that can correspond to other systemic diseases such as heart disease, gut problems. It can just throw off the microbiome of your mouth. So obviously none of us want cavities, but it can affect your overall health. The second one, and probably the most common, is your gum health. So your periodontal health. My hygienists here at our office are extremely trained in the oral systemic connection. They've now linked 57 different diseases to the pathogens that start in your mouth, and almost all of these are directly related to your perio health. Most of these we can get to with regular oral hygiene, routine hygiene visits, but there's some that we can't. And the cool thing is now we have the ability to test for some of these, and we have some great technology and treatment options to help you get your natural bacteria and those pathogens back in check. So perio health is extremely important to us here at the local dentist, and we'll talk to you about that. Third is your TMJ, or your joint health. So I feel very fortunate to have trained both in dental school, in my time in the military, and since graduation from my residency program at the University of San Diego Medical Center and the Naval Hospital. We have been able to offer some great TMJ services. So whether you got a clicking jaw, you feel like you deviate to one side or the other, or you just have some jaw pain, then we can help you diagnose that with some imaging equipment. We have some great treatment options, as well as we're able to use regenerative medicine now to treat a lot of TMJ issues with platelet-rich fibrin and splint therapy. So your TMJ health can directly affect your mind, right? Because you're thinking about it all the time, and then can obviously, I use the analogy, it's like a door on a hinge. If the hinge is off, then the door is not going to fit quite right, and it can be the same thing that happens with your teeth. Which leads me into the fourth thing, which is your occlusion, or how your teeth fit together. If you have wear on your teeth, or you're hitting and sliding, then you're at higher risk for causing some long-term damage. So we talk a lot about the balance of your bite, how things fit together, as well as how to chew properly and how to function properly. So we've teamed up with some great physical therapists, chiropractors, as well as I've been able to train with people like the Kois Center down in Seattle to help you get your bite back in check. And the last one that we screen for, as well as we treat patients for, is sleep apnea, or your airway health. So we screen every single patient for airway issues. Sleep apnea is the most common non-communicable disease in the United States. It's about 40%. And it leads to a whole host of other issues. So we want to help you get that in check. We want to help you screen and get to the right place, and we have some wonderful sleep physicians in our community, both in Skagit and Whatcom County, and even as far down as Island County, that we can work with to help you figure out what's going on and get the proper treatment, whether it's with us or with treatment that they recommend at their office. So those are the 5 ways that we really focus on: tooth decay, perio health, your TMJ, your joint, your occlusion or your bite, and your airway health. We look forward to helping you screen and get those in check and stay healthy, because as we all know, prevention is way more cost effective and affects, can beneficially affect your overall health in tremendous ways. We look forward to treating you, and if you have any questions, feel free to let us know here at the local dentist, and I look forward to answering them. Thanks guys, bye.